Hey everybody, Amy Register here with the Home Health Mentor, Teresa Register. And if you are just joining us, please do not think that you are getting free bonus material, although you are. We actually just did this Friday Q&A, didn't like it, and decided we're doing it over. So thank you for joining us. If you're wanting to hear it again, that's great. If you're hearing it for the first time, it's going to be better than the one you missed. So please welcome my mom, Teresa Register, to tell us a little bit about some of the values that have helped her company be excellent at marketing and grow their business, and some of the overarching strategies that will help you do well.
So, thank you for joining us. And I wanted to give a little background about the organization that I work with. We started about 5 years ago and started, of course, like most do, with a handful of patients. We currently have, I believe, over 1,100 patients, and that is our average daily census, not our cumulative number of patients. That is the number of patients we have on an average day. So it has grown by leaps and bounds. And some people have asked what we do to market. Why have we grown that quickly and to that level, especially in a very competitive market? So I thought I would spend a little bit of time going into our history and a little bit about how our philosophy of marketing works. So to start with, let me just say that our philosophy is that when we take good care of our employees and we hire good, competent employees, they are going to be our best marketers. They are the ones that are out there face to face with our patients, and our patients and those employees are our best marketing team. We don't have tons of people that we pay to go out and do marketing. We do have a marketing staff, but when you compare the success with the number of marketing people we have, it's clear that our referrals come to us because we have happy referral sources, happy patients, and happy employees. So, foundationally speaking, that is what I would say is the best reason that our agency has grown over the last 5 years. So
Yeah.
Go ahead,
That's
Amy.
super important. That's super important because I'm thinking about all the times where I've been at social events or parties and someone, you're checking in on their family. Hey, how's your mom? Or, hey, how's your dad or sister, whatever it is. And, somebody's been struggling with healthcare. And if you're an employee of a healthcare company, you have a choice to make. If you love your company, you say something like, I'm sorry that's not going well for you. Have you considered home health care, or have you considered this, my agency or whatever? So you're faced with that decision. You got the opportunity to either market or stay silent a lot of times over any given year. And if your people love where they work and they are confident in the agency and what the agency is doing, now you've got people driving referrals like person to person, which is so valuable.
One of the things that I remember being told by a manager, a supervisor, was I would have to be in bed sick to not want to come to work. To me,
Wow.
that really said a lot.
Mhm.
So it's really important to take care of your staff. Your staff will take good care of the patients, and feedback back to the referral sources will keep the referrals coming. So I think just to talk about foundationally what the backdrop is for good good growth, I'd say that's more important than quotas.
Mm-hmm.
So our philosophy is quality care, not quotas.
Nice.
That's, yeah. So um, we talked a little bit in the past session about marketing, but I thought of an example or an analogy that I wanted to share, and I called it slug versus buckshot marketing.
Mm-hmm.
And knowing a little bit about guns, not a lot, but a little about it, it made me think about this in terms of how you market. So buckshot contains a lot of small lead pellets inside a shell. And when the hunter shoots buckshot, the little lead pellets spread out and they cover a wide range when they're shooting at their target. Most of the pellets will miss the target, but if you're close enough and lucky, at least a few of the pellets will hit your target. In comparison, let's look at slug, how a slug works. So a slug contains a single large pellet. It's more like what you would think of as a bullet. So if you're shooting a slug, you really need to hit the target with a direct shot. But if you do hit it, you only have to shoot once. And it's kind of like that with marketing. A lot of agencies, when you start out, you're probably doing more like the buckshot marketing.
Mm-hmm.
You are just going out there and, frankly, in somewhat of a frenzy, trying to hit every doctor's office, every clinic, every
Mm-hmm.
person you know, trying to get some kind of a referral. May not be a good referral, but you're trying to get referrals.
Yeah.
So that's how a lot of agencies begin. The problem is they never mature and begin to focus their marketing efforts. They keep doing that kind of thing instead of taking a more measured approach and developing a good strategy. And the
Mm.
reason for that is a lot of agencies have not done any good marketing research before they try to open their doors. There a lot of times what I've seen, what I saw as a surveyor was that you might have a nurse who has done home health for a number of years and thinks, "Oh, I'm going to open my own business. I can do this."
Mm-hmm.
and and they are qualified and competent when it comes to the clinical side, but they may not have had any experience with doing a SWOT analysis or a strategic plan or any marketing research. And so what happens is they end up doing the shotgun approach to marketing. And they may get lucky and some of the pellets will hit the target,
Mm-hmm.
but that only that only does so much. So what I would propose is that people think more in terms of slug marketing.
Mm-hmm.
And what I mean by that is you really need to go back if you haven't done a good, strategic plan or a SWOT analysis. You need to figure out what that is and do it yourself, which is actually, in my opinion, better than hiring someone to do it because there's nothing like, the frontline experience of finding out about your competitors. Um, so, get back to the basics, do your own research, define
Mm-hmm.
your market,
Mm-hmm.
look at your geographic area and what is happening within the healthcare industry in that service area. And what I mean by that, let me kind of give a couple examples. We when in years gone by, when I was working in Southern California, one of the hospitals that we were associated with began a more serious cancer treatment program. And we had a hospice program, but we didn't have really what I would consider any specialty nurses that were, familiar with taking care of hospice patients or dying patients. At the same time, or about that same time, the hospital opened a pediatric hospital. So now we had oncology and pediatrics, and I could foresee that we were probably going to get pediatric oncology patients.
Mm-hmm.
And so one of the things that we immediately began to do was to look for a nurse with good pediatric oncology experience, and um, you know began doing some strategic planning toward that end. We also published a small booklet on pediatric oncology that was designed for siblings of pediatric patients. So, because we recognize that a lot of times those children got left out when the focus was on a sibling that, had cancer. So, that's just a quick example of how your market might determine your strategy. Um, you may be in a
Mm-hmm.
geographic area where you have a psych hospital, wound care clinics, maybe a heart hospital, maybe a group of orthopedic physicians that have opened their own hospital. All these are important considerations when you are looking at how to market your services. You you really want to design your strategy based on your market, and you can't do that unless you've done a good market research. So
Mm-hmm.
that's that's really important that you do that. And then another important thing to look at is who are the payers in your service area for the kinds of patients that you're likely to be getting
Mm-hmm.
from your referral sources. So most agencies are largely dependent on Medicare and Medicaid, even though there are certainly other large payers. We tend to focus on the elderly population because they tend to be the ones that are homebound, and Medicare tends to be the primary payer of services for the elderly. So certainly Medicare is a big consideration, but also keep in mind the other large employers that might be in your geographic area,
Mm-hmm.
and who insures those employers or those employees of those employers. So that may cause you to go after referrals from that insurance company, which means you would try to set up a contract to provide home care to their patients. And a lot of times that is done in lieu of hospitalization. And a lot of
Mm-hmm.
insurance companies will agree for you to take care of their beneficiaries if it's in lieu of hospitalization, which is usually a lot more expensive.
Mm-hmm. Yeah, that's cool.
So, yeah. So keep in mind, whoever the payer is, they want to see value for their dollars. So you will want to approach them with hard evidence that the care that you're providing, the outcomes of the care, is going to offer them something that your competitors don't.
Mm-hmm.
Otherwise, you are just another home health agency out there. So you may want to look at who you are hiring as far as staff. You want to hire staff who have the credentials and the confidence and abilities to take care of the kind of patients you're going to be getting from those referral sources. So if you have a heart hospital, you might want to, make sure that you hire nurses that have really good experience with cardiac patients. The same with oncology. If you have referrals coming from oncologists, you're going to want nurses that are really familiar and comfortable with caring for oncology patients. Anyway, you get the idea. You want
Yeah.
your staff to match your strategy for
Yeah.
your marketing program.
I want to jump in here because
Okay.
this is like marketing across the board. Like you want to see where the need is and build your business there, build your marketing plan there, build your staff there, as opposed to, hiring your best friend's aunt and trying to get referrals that are just for her. Now, in home health, I really think you can do it both ways because there's, people have the same health problems across the board. But yeah, like mom's saying, if you have certain hospitals and specialty cares in your area, people are going to be concentrated on that. It just makes sense to strategize your business building and your marketing around what already exists. It's just going to be much easier for you to get started and make dollars, make your agency go somewhere.
Yeah, it's, if you just open another home health agency, just like the rest of them, then you're competing for just everybody else's, general referrals. But,
Mm-hmm.
um, and you really can't expect people to send you referrals just because you opened your doors. You have to show them that you have something to offer that your competitors don't. And so you want, highly qualified staff that you can put out there in your brochures. We have, for example, we have an ostomy nurse, or we have nurses with these kinds of credentials. That tends to, make people feel more comfortable making a referral to you because you have credibility in taking care of their patients. So, so it's really important for you to understand that it's your job to design your services to meet the needs, not just open your doors and think everybody should start flooding your
Mm-hmm.
staff with referrals.
Yeah, but we have quality care.
Yeah, you have to have, yeah, I mean, just be smart. You just have to have, something that you're known for. If I were talking about businesses in general, um, you're not going to go to Taco Bell probably to order a Big Mac. You can't just open your doors and think that somebody's going to send you wound care patients if they don't know that you can take care of those wound care patients. You market to the product that you have, and your product hopefully is directed toward the kind of referrals that you want, and that you
Yep.
can show good outcomes, for your patients.
Yep.
So, just a minute. So, back to the strategy. You want to make sure you have the right staff to take care of the types of the patients that are going to be referred to your agency. And sometimes you can hire people with those credentials, and sometimes you have to train them.
Mm-hmm.
So make sure that you keep in mind that if you're targeting wound care patients, you may want to send one of your good nurses for ostomy training, or you may want to go and take that training yourself. But you want to make sure that your staff credentials line up with the kinds of patients that you want to market to.
Yeah. You've been using we talked about like bullets and slugs, buckshot and slugs. To make it even more Midwest, I like the analogy of the stream. Like you got to see where the stream's flowing, what kind of fish are already in it, and then you bait your hook for those fish.
Oh, well, that's a good analogy.
Thank you. I just thought of it.
Yeah.
Yeah,
Yeah, you're
because
not.
your bait could be so good that fish from all around come to it, but yeah, it's way easier to know what you've got, know what's there, and then get the right bait for what is already going on in your area.
Yeah, that might be a little outside of the wheelhouse for some people, but I definitely understand. Anyone who's a fisherman is gonna understand that. So
I'm not even a fisherman. I don't even eat fish.
and you understand it.
Yeah, I think they
Um,
got it.
right. Well, let me just summarize here and just say that the more you know about your market and the better your staff qualifications match the needs of your referral sources and therefore of your patients, the better your outcomes will be, and the more likely your payers are going to be the ones to insist that the patients go to your agency, or that they fight for you to get those patients sent to you.
Mhm.
So do your research, make sure that you have a good sound strategy, and then load up those slugs and let your competitors be the ones using buckshot.
Yes. All right. Well, that's about it for us today. Um, we hope you have enjoyed this Q&A Friday and would love to take your questions on marketing. And if you have any more specific things, Mom can always direct your questions to other people that she works with in agencies. So don't feel shy. And Mama, what did you say you wanted to do next week?
So I'm hoping next week to talk about what is a quality referral. If you've got marketing people out there, some agencies are paying on a per referral basis, and a referral that doesn't turn into an admission is not a good referral.
Yeah.
You're going to have some of those, but you want them to be, minimal. So you want people spending your resources, your time, money, efforts on getting referrals that will actually turn into an admission. So, yeah,
Mhm.
next time I'm hoping that we can spend some time talking about what is a good referral.
Awesome. All right. Yeah, we want to protect your dollars and your time here. That's why we're doing what we're doing. And we hope that we can continue to serve you at a high level. Please message Teresa Register, the home health mentor. Facebook is the easiest way to do that. And we see that most of you are watching on Facebook. So we appreciate that. And we will see you next time on another Q&A Friday. Thanks.
Bye.